Well, good morning, everyone. My name is Michael Kilfoyle, and welcome to today's webinar on the results of the 2017 Vermont Benefits Survey. So I appreciate you all taking the time to review this information. And for those of you that don't know, our survey we've been doing it since 2001, so this is the 16th version of it, and there's been some interesting trends over time, which we'll be talking about as well. So I have everybody on mute right now because we had a pretty a large crowd, and what I would ask, if you have questions along the way, maybe just throw in a chat there, and I'll check that periodically to see what questions there might be and how I can try to respond to them so we can get the most out of the time that we have together today. I'm not sure that we'll use the entire hour, but at least 45 minutes or so to go through all the material. So hopefully you're looking forward to this as I am, and we can talk about what the trends are. So as I mentioned, we've been doing this for a long time, and the trends that we're seeing are quite interesting, particularly around medical insurance and what folks are doing there from an employer perspective, because there are some interesting and innovative things that employers are doing there. So we'll talk about some of those trends. We'll talk a little bit about what's happening on the ancillary side of the benefits world, a little bit about paid time off, and touch on compensation as well. So a lot of happening in our marketplace in Vermont. We're a unique state in a number of different ways, and plays out on the benefit side as well. So without that said, let's start in, and we're going to start with medical plans and what's happening there. And this is a slide that I show every year, and it's a little depressing, but what we're going to see here is, if you look, the bottom two lines here, the light green and sort of that turquoise line, that's workers' earnings and general inflation. So you can see over time that's hovered between 3 and 5%, and then we had that big dip in 2008 because of the recession. But generally speaking, it's been pretty flat over time. Now we look at the more interesting graphs here, and we've got the blue line. That is national health insurance premiums over time. So you can see that these have fluctuated greatly, but more recently they've actually dropped down a little bit. And just a little historical perspective for everybody, if you look back in this 1996 timeframe, you might say to yourself, wow, that's a precipitous drop there. What was happening there? And for those of you that have been around a while in the HR or benefits world, that was when the Clintons took over the presidency, and they were talking about Clinton Care at the time, which is a little bit like single payer. And so the carriers decided that all of a sudden they could get a little bit more competitive with their rates, and they did. So the other thing that was happening at the time was there was capitation going on with HMOs, and so that was able to drive down costs a bit. But then it started increasing back, and you can see back in about 2003, the average increases were somewhere in the neighborhood of about 15%. Big numbers. So then we've had some drops, as we talked about, and this red line is when we started our survey back in 2001, and we can see the trend lines. Generally speaking, we're kind of tracking along national data, but then we've seen in the last few years that there's been this gap between what national health insurance premiums are doing and what we're doing here in Vermont, which is concerning, quite frankly. There's a number of reasons for that. And by the way, this national data comes from Kaiser Family Foundation. Some of you are probably familiar with that. It's a great source of information if you haven't seen it. They put out a survey about the same time that ours is released in September every year. And so I'd recommend going to check that because it does provide some really good information. So that said, what's going on in Vermont? Well, a couple of things are going on in Vermont. One is we're a small state. We don't have a lot of competition on the either provider side or the carrier side, and our utilization and our demographics are a little bit different than other parts of the country, which leads to higher rate increases, because obviously that all flows through ultimately to all of you as employers, that you get these rate increases. So we've got some work to do here in our state in terms of how do we try to contain costs as best we can, but still allowing great access, great care, et cetera. So this is the never-ending problem as I describe it, and shown in a different way. This is the graphs just in different format. This is my paycheck erosion slide. And what I essentially mean by that is that as much as these health insurance premiums go up, if workers' earnings aren't keeping pace with that, your paycheck gets eroded. So even if you're getting an increase, if those contributions that you're getting from you're having to pay in, it's eating away at that paycheck. So it decreases purchasing power. Number one. Two is it doesn't allow more money to get into the economy. So we're essentially, I think the last I saw in Vermont, we're at least 20% of gross domestic product is related to healthcare. So this is obviously a big issue, and it's a big struggle for employers because you folks have to be able to figure out, well, how are we going to pay for this stuff, because we still want to attract and retain the best talent. What are the strategies that our employers are doing to try to do that in containing costs and still offering a great benefits package? So we're going to talk a little bit about what that is today and what are some of those strategies. You can see there on the top right of this slide, average premium increases in Vermont of 8% per year over the last 15 years. That's a big number, and you compound that over time, and that adds up to a lot of dollars that are going towards healthcare. So how can you best try to mitigate those increases going forward? So again, we'll talk a little bit about that. I do like to put Vermont into context with national data because I think that's helpful. And what this is showing, this is a slide from Kaiser Family Foundation, and talks about the dark green in this graph are worker contributions, and then the light green are actually the employer contributions towards the medical plan. And what you're going to see here is that more and more of the burden is getting shifted towards workers. Even though the increases aren't as great on a national basis, the percentage that the worker has to pick up of that premium increase is greater than what the employer is picking up. So again, that leads to this paycheck erosion. So that's not necessarily the case in Vermont. If you look down at the bottom of the slide there, you're going to see that in 2017, the family premium for Vermont was just about $20,000, which is a scary number to think about because $20,000 is just going to health insurance to participate or to include your family in that coverage. That doesn't include copays, co-insurance, deductibles, et cetera. So that's a big number. That number is 5% higher than the national average. So we pay more for our health care here in Vermont than other parts of the country on a national basis. In 2017, look below that, the family employee contribution was $5,232. This is from our survey data. That's 8% lower than the national average. So interestingly, what we're seeing here is that, yeah, we pay more in total, but our employees actually pay less. So what does that tell us? Well, that tells us, and this is probably no surprise to all of you, that Vermont's a little bit more paternalistic when it comes to offering their benefits, and generally speaking, try to absorb as much of the burden of increases as they can, and without cost shifting over to employees. So that's sort of a good story to tell from the way Vermont employers go about their business, but it's a bad story to tell in that our numbers here are higher and it isn't sustainable. So we have to figure out a way to again try to mitigate those cost increases. And what we're going to see is some of the more innovative companies are coming up with strategies like pricing transparency tools and on-site clinics and different things to try to get back control of their health plan. So let's talk a little bit about what's happened is going to happen in Vermont. So going back, we've got community rating, and that's for the smaller group pool. And community rating essentially means that you can't differentiate based on geography or sex or demographics, age, etc. There's one rate for any size group that's in this small group pool. Vermont was one of the first states to do that, and the reason they did that is because they wanted it to be equitable, so that some folks weren't getting charged a lot more based on either conditions or geography, etc. And then back in 2010, which is hard to believe, the ACA passed. So that's going back 7 years ago, and that led to a lot of things here in Vermont, as you'll recall, that allowed the state government to say we're going to pass a law that we want to put into place a single payer system, and you'll all recall this. And part of that was trying to leverage the ACA tools to be able to do that, and the start of that was Vermont Health Connect, which was launched in 2014. If you remember, that Vermont Health Connect was supposed to be the launching pad to ultimately get to a single payer system here in our state, and there was a lot of discussion about that. And so you're all probably familiar with this, so I won't get into too great a detail, but one of the things that it did have was a huge impact on employers in terms of the decisions they could make. Because there was so much uncertainty in terms of what was going to happen, we weren't seeing a lot of movement in terms of we were either switching carriers or changing plan designs or implementing new strategies, because everything was so up in the air that it was hard to make good decisions. And as I always say, businesses are rational and they have to have good information to act upon. And at that time, they didn't feel like they had really good information to act, so they weren't acting. So a lot of inertia during the 2010 to 2014 timeframe, until ultimately, as everybody remembers, Governor Shumlin pulled the plug on the single payer system because he found that it was going to be unaffordable for our state. So then we fast forward, and so the Green Mountain Care Board, the group that governs the healthcare in our state, they then went ahead and said in 2016, small group plans up to 100 employees would be now going into the exchange, Vermont Health Connect. And just as a reminder, Vermont's the only state that requires all small group plans that are fully insured to be in the exchange. No other state does that. So we have a different model here in our state. So subsequently, we have the exchange going on where small groups are in there along with individuals. And then we have this thing called all payer waiver with ACO, which is Accountable Care Organization. So that's now the big topic of discussion. And while this webinar is not meant to go into too great a detail there, that's the next big wave that's hitting our state when it comes to healthcare. There's a lot of activity around this right now, and I'd urge all of you to stay on top of that, because ultimately it will affect employers and how we go about our business. And just quickly, from the broadest, biggest picture perspective, what all payer waiver does is it's a federal waiver that allows the state to basically block funds to then provide to providers to take care of a population. So it moves from a fee for service where we go in and get charged for a specific condition or a specific treatment or a specific technology, whatever the service is, to a block funding where we're giving providers a whole bunch of money to manage a whole population. And that's both on the governmental side of healthcare, which include Medicare and Medicaid, and also commercial insurance as well. So ultimately that will flow back to employers should this really get off the ground, and there's a lot of movement on this right now. So we'll have to keep an eye on that as we go forward. Now, there's also the whole idea of repeal and replace. We've heard a lot about the Republicans trying to repeal this, and they failed twice already. And then so President Trump has most recently issued an executive order to eliminate the cost-sharing subsidies within the exchange, which has caused a lot of heartache for a lot of states. And I was reading in Vermont Digger about how our state is going to join a bunch of others to sue the federal government to say that they can't eliminate those because it's not right, et cetera, et cetera. So there's still a lot of conversation around this. And my take on that is, well, the Republicans can't get their act together when it comes to repealing and replacing it. There is still going to be more to come on this, so we've got to keep an eye on it. So what that's doing is creating instability in the marketplace because no one knows exactly what to do again. So here we are back to a position where businesses are rational. They're not exactly sure what to do because how's this ACA thing going to play out? And one thing I do want to mention too, we had a lot of conversation about the Cadillac tax for larger employers that offer rich benefits going back a few years. That conversation is not going away. We kicked the can down the road till 2020. That's around the corner now, and that has not gone away. So employers used to start thinking about taking up those conversations again and looking at that again and doing some analysis, because at this point, it's still the law of the land and we've got a plan for it. So then ultimately the question is, well, what now? Well, what now is a lot. We're dealing with medical trend. Think about that in terms of inflation, if you will, medical inflation. And there are a lot of factors going into trend, and you can see there on the left, we've got utilization, how often people utilize the plan. We've got prescription costs. We've got general price inflation. There's a concept called leveraging, and I'll just take a minute to explain that. Leveraging is essentially saying if you've got let's call it $100 deductible, and the cost of service this year is $95. Well, that is not going to be subject to the insurance company paying for that because it's below the deductible. But let's say there's a 10% cost increase. Well, for next year in terms of inflation. Well, now that $95 procedure, let's call it, is $105. Well, now it's going into the insurance, which then means the carrier has to pay that. If you're not adjusting deductibles and co-insurance, you're going to have this thing called leveraging, which is more and more of the cost is going to be picked up by insurance carriers. Hence, they are then going to pass that cost along to you. So you want to just keep an eye on what your deductibles are as we go forward. Mandates and new treatments, of course, also contribute to these factors. So what are the trends that we're seeing? Well, medical trend, we're seeing anywhere from 6 to 11%. And the way I like to describe that is if you come in exactly where the insurance carrier wants you to, your plan is going to increase by 6 to 11%, depending on the carrier that's playing. So that's not a great story to tell. That trend is pretty high. Now, that's also a little bit in a conflict with Green Mountain Care Board, who is holding hospital budgets to 3.5%. So at some point, I think the Green Mountain Care Board and probably the legislature in Vermont is going to dig into that a little bit deeper to have these numbers more aligned. One thing that they don't control or can control are prescription costs. And you're going to see there that the prescription trend that we're seeing is almost 12%. And a lot of that is made up of specialty drugs, and probably a lot of you are familiar with specialty drugs, but what those are those that treat conditions that are very tough to manage, but they're almost like cures, and in a lot of instances. The example I give is hepatitis C. There's a couple of drugs out that treat hep C, and not just from a treatment standpoint, but actually cure it, but it's very, very expensive, $95,000 for an 8-week treatment, and sometimes those treatments don't take, so you have to do 2. So an employer can have all of a sudden a $200,000 claim for a specialty drug over a couple of months. So a lot of you, if you're going through your renewal process right now, you might be seeing some spikes in your drug costs, and likely it's due to these specialty drugs, and more are coming out into the marketplace. So you're going to see that 35% of all prescription costs are made up by specialty drugs, and that's up from 25% in 2015. I've seen a lot of statistics out there that are saying that prescription drug costs over the next few years are going to be about 25 to 30% of our total medical spend. That's up quite a bit from years past. So a big thing to keep our eye on is specialty drugs and the impact that it's having. So I just wanted to talk a little bit about the marketplace in general, because what we're seeing is, as you can see that I screenshotted Vermont Digger, that Blue Cross requested a 12% premium increase for Vermont Health Connect this year. Ultimately, it was approved by the Green Mountain Care Board at 9.2%, but we're seeing these numbers, these big numbers impacting our marketplace. And at the top of the screen there, you're going to see our Vermont health insurance premiums over time. And as I mentioned, over time, we've averaged about 8%. So again, big numbers to deal with. But then there is this conflict with the hospital budgets, which are 3.6% of total requests. And they only, that was the total request that they had, and they requested 2.4% from commercial insurance, like most of you are providing for your employees as well. So a little bit about just what's changed since 2010, because that was a benchmark year when the ACA came out, because there's so much going on and so many changes, and I know a lot of you are having to do the reporting and et cetera, et cetera. So what has changed? Well, we've got public exchanges now. We know that. We've got these employer penalties, which, you know, there's a lot going on there, including federal and Vermont, based on your group size, et cetera. We've got these actuarial values now. That was not in the conversation before, and we've got minimum essential benefits. And then originally the Cadillac tax in 2018, as I mentioned, but that's now getting pushed to 2020. So also what we're seeing is technology a lot, because like with Vermont Health Connect, you can probably remember some of the struggles that they had, but ultimately it's working now. But there's this whole enrollment administration role that comes to enrolling these health plans, and more companies are looking at this concept of defined contribution, where you're setting aside just a bucket of money to allow employees to choose a plan that's appropriate for them. We'll talk a little bit more about that, but that has been pushed along here in our state because Vermont Health Connect does allow for that type of platform. So smaller employers in particular are going down this defined contribution route, because there's no real downside to them to offering all the plans that are available in exchange, and there's plenty of them, and they can peg their contribution to either a particular plan or to a dollar amount. So we're seeing a lot more defined contribution conversations, and usually those conversations are driven by larger employers, and then it flows down. Well, in our state, it's starting from smaller employers and flowing up. We saw the same thing happen with high deductible health plan adoption, by the way. Small groups found out that they could implement high deductible health plans with an HSA or an HRA for cheaper than traditional plans back when they were introduced. This is going back to like 2005 or so. And so smaller employers led the charge in that regard, and then larger employers here in our state did that as well. And then lastly, the changing of the delivery systems I mentioned. We're looking at a fee-for-service system right now. Are we going to go to this all-payer system, and how will that ultimately affect employers? So what I say there on the right in red is that we are creatures of habit and our condition in terms of our approach when it comes to medical plans, and in educating our employees on how we go about this and what choices we are. And there's a one-size-fits-all mentality in a lot of employers where these are the benefits that we always offer, this is the way we want to do it. But some of these old arguments aren't valid anymore because the technology has improved. Carriers have gotten more flexible in the way they approach offering additional plans, and also employers need to think differently in terms of managing their plan, in my view, because the old arguments in terms of how we would try to negotiate a renewal, they're not valid anymore. We've got to come up with a different approach, and that's what we really want to talk about this. So one of the questions that I get asked a lot is, can't we just get out of this game? Can we just stop offering medical insurance? Because boy, it's so much of a burden to our organization from a cost perspective, but also from a compliance perspective. And can't we just give our employees money, convert the healthcare dollars that we have to salary, and then they can go purchase on the exchange? The answer is theoretically yes. So on the top there, you see the face of it is the easiest to do. You've got public exchange with subsidies, and the old argument I mentioned there is that nobody could get individual insurance because they would be individually underwritten, et cetera, et cetera. Well, now they can go into the exchange. So we would just convert our money that we give them on healthcare to salary. We wouldn't have to deal with administrative overhead, et cetera, and we just live happily ever after. Well, the reality, of course, is much different. There's the employer penalties that I mentioned before. There's also the tax implications to employer and employee. So it's deductible for both the employer and it's tax-free for the employee. So that is then lost. And then in terms of converting to salary, don't forget that you'd have to include on top of the salary that you convert workers' comp, the FICA match, the 2 point something or other, 3 point whatever it is, that half of 7.65, and then also any retirement contributions. Then you've got union contracts that you might have to deal with, which means you can't pull the plug. And then it's also from a competitive attraction and retention standpoint, will you lose employers by not doing this? Now, some people are still talking about this, but generally speaking, most employers who have gone through this exercise have found that this is not a viable strategy. It puts them at a uncompetitive, let me try that again, a disadvantage competitively, and it's also from a fiscal standpoint, the numbers don't work out. So it's still better to offer medical insurance, say most of the employers that go through this exercise, than not. But then how do you try to mitigate those cost increases as we talked about? So I wanted to talk, just getting back to basics for a second, like what are the fundamental factors in offering health insurance in the first place? Well, first you've got recruiting and retention, and you've got the tax deductibility, et cetera. You guys can read as well as me. But ultimately, there's a lot of fed upness, if you will, when it comes to offering a health plan anymore because of the complexity, the compliance, the cost increases, et cetera. So what are we going to do about this? We've got to figure out a better way. And so here's what you guys are dealing with, right? You've got sticker shock. You've got 5 generations in the workplace because we've got digital natives entering the workplace now. So they all have different needs, and what we typically are still offering a one-size-fits-all approach, which might not be the best way to go about it. You got this compliance stuff. You've got plan complexities. We have to explain what all this stuff means to employees. But we do have, speaking of employees, they're more savvy. They're used to shopping for different things and being in control of purchasing, yet on the healthcare side of the equation, they're not. We've got these public exchanges, so that can, employers want to know, can I offer my plan in there? You've got increased cost sharing, plan design changes, and then not meeting all the benefit needs of employees and their families. So despite our best intentions, we may not be meeting the needs of all of our employees and their families as well. So you've got a lot to deal with, obviously. So what are your options when it comes to this stuff? Well, I suggest there's 4. The first is what I call DNA, which is the do-nothing approach, and that includes crossing your fingers at renewal time. This is not a viable strategy, as I'm sure you're all aware, but it still does happen. So you go through your renewal process, it's painful, you try to get to the best rate you can, you got to change your contribution structures, et cetera, and then you put it to bed for a year, and then come September, October the following year, you cross your fingers again and hope it works out. Well, that's, again, not a viable strategy. Number 2 is self-funding with active plan management. We'll talk talk a little bit about what that means. That's where employers are taking back control of the health plan, and they're the ones that are innovating. They're not leaving it up to the insurance carriers or the providers to manage. Then we've got defined contribution, which we touched on, and then 4 is stop offering health insurance. So really the 2 in red are the ones that we want to explore today based on the data that we're getting from our survey as well. So let's get into some of the data. So what are some of the funding arrangements that employers who participated in our survey told us that they were using? Well, you can see there on the left that fully insured, which means that the risk is being transferred to the insurance company. There's still a large number of employers that are doing that, but what we're seeing is more and more employers are moving to self-funding for a lot of reasons. One is it avoids some ACA fees, but 2 is employers that are savvy and trying to be innovative recognize that going the self-funding route will allow them to better actively manage their plan and get more information to be able to do so. So this goes down to groups of 50 here in our state, and I was giving a presentation recently in another state, and they were talking about how it goes down to 10 there. It's still 50 in our state. That's pretty much the line, but it used to be that you had to be about 250 or 300 employees before you really wanted to look at self-funding, but more and more employers are doing that now, and there's some interesting ways to self-fund now without taking on that total liability or that total volatility that you get from self-funding. We'll talk a little bit about that as well. So anyway, more self-funding that we're seeing. I wanted to go back a little bit when we talk about plan changes. This is back from 2010, and what the strategy back then was for employers was they were just chipping away at plan design and trying to mitigate costs that way. But ultimately, if you keep chipping away, you left with a plan that's not really appreciated by employees. So what we were seeing was employers started jumping over to high deductible health plans, because if you remember, everybody was saying, hey, this is the next greatest thing, it's going to solve all our problems. Well, obviously that wasn't the case, and what I suggest now is that employers have hit the wall. There's no new plan design out there that is going to be the panacea that's going to solve all our problems when it comes to containing costs. So the wall is here. So what are we going to try to do about the wall? And here's the picture of the wall, right? What are we going to do about the wall? Because if we've got no plan design changes on the horizon, the cost increases are still 8% per year. We can't just keep crossing our fingers. We've got to do something differently to try to maintain a competitive plan and keep it affordable. So let's talk about high deductible health plans, because this could be a part of the strategy. What's interesting here is if you look at the dates over time, you're going to see that there is a huge adoption rate in Vermont of high deductible health plans. This is, by the way, much, much higher than on a national basis. We lead the nation in high deductible health plan adoption. Part of that was because, quite frankly, one of the insurance carriers back in the day in 2005 mispriced them. And as I mentioned, people found that businesses are rational. So they found that they could go to a high deductible health plan and implement a health savings account or health reimbursement account underneath that and be a better plan than their other plans for a less cost. So anyway, that's one of the reasons for the adoption. So what we're seeing here is that there's a high level of adoption, but what we're seeing is it's also trailing off a little bit in the last couple of years. Now, part of that reason is because smaller employers, because high deductible health plans have now trended actually a little bit higher than traditional plans, they've been adjusted from a cost perspective, that people found that when they were going into the exchange, they could offer the platinum plan or a gold plan, and it was a better plan than their high deductible plan. So that's why we think that the adoption rate is going down just a bit. But it's still a major thing that employers are doing, and from an actively managing your plan standpoint, it's still a viable strategy because there are more consumer tools available to employees now to be able to be better consumers of healthcare. When these were introduced, everybody talked about, oh yeah, it's great because employees can now do shopping. Well, the reality was they couldn't because there's no tools available. Think about it from your own perspective. If you went to your doctor's office before getting your EOB, you might not know what the cost of that service was or what's the cost of an MRI. That's evolving now. We're getting to a place where we have better data to be able to do that. So a little bit about cost increases. Well, here are the numbers that we talked about. And now high deductible health plans and traditional plans are leveling out. Again, we're seeing those increases in the 8% range, and that's over time. So not much is changing there. So again, we've got to try to do something differently as well. So here are the things, as I mentioned, are employers considering it? Well, not really considering dropping health insurance. That's not really a viable strategy. I think they've come to that conclusion, so I won't spend too much more time on that. But here are some things that people are considering. So if we look at 2016 and 2017 data from our survey, there are a lot of employers that are both considering or have implemented defined contribution arrangements with their employees. So if you haven't thought about this as a strategy for your organization going forward, I would suggest that you might want to take a look at this. It may sound a little bit daunting to offer multiple plans and how do you come up with a defined contribution strategy, and there's definitely some work in it, but I think this is something that more and more employers are going to be using going forward, both from a cost containment standpoint and from an employee choice standpoint, because at some point employees are going to stand up and say, I need a different plan than the one you're giving me, and it's not working for me. Some other things that are being implemented, consumer pricing tools. That may mean you have an app on your phone that tells you a lower cost provider in a certain geographic area. And if you use that lower cost provider, well, perhaps you get an incentive from your employer to do so because you're getting a lower cost, so it's a benefit to the plan as well. So innovative employers are starting to use tools like this to help create that consumer mentality. Now, it's not perfect in every situation because you have to have the data to be able to share with that provider, whoever it is, the consumer pricing tool provider. So it's like if you're fully insured with Blue Cross right now, it's very hard to be able to do that. But if you're self-funded, you can actually use a tool like this to help facilitate that process. Then claims analytics software, that's another thing that's becoming more popular. Still sort of low in terms of the implementation and considering rate, but those employers who are really trying to actively manage their plan are using more advanced software and data analytics, not only to look back, because that's the easy part in terms of, okay, where are our claims dollars being spent on, but it's looking forward to say, where would they be going if we don't do something about it? So it's more predictive modeling going forward. On-site and near-site clinics is another hot topic that employers are considering. That could be we're providing primary care facilities that the employer is sponsoring and funding, and allowing employees to go there with their dependents to have a longer visit with their PCP, as well as get some health coaching. So again, employers are trying to take back control of that process. So that's an interesting thing. Narrow networks is not something that we're seeing here in Vermont, and that's essentially where we're saying, hey, you can only see a few people within this network, and we're not going to make this very wide, so forget the PPO. And that drives down costs because the providers are then guaranteed to get payment. So we're not seeing that much here in our state, but in other places, this is becoming a very popular strategy. Now, I just want you to take a look on the left there. I'll let you guys read through those numbers there. This is a transparency tool data, and you can see the differences in different areas. So this is an opportunity for, it's not for brain surgery, right? It's for those sort of transactional items that someone may have when it comes to healthcare, and that doesn't have a difference in quality necessarily. So you can look and see there are some differences in prices in different areas. So again, this is something that employers are starting to do with consumer pricing tools to allow them to be better consumers. And what I like to say is, when you go down this approach, when you're trying to actively manage your plan well and you're self-funded, you create this environment of that we're all in this together, and creating incentives for that to work for employees and their dependents. On the right there is just a screenshot of an analytic tool where you can get some really, really good information. So let's talk a little bit about what the long-term strategies are when it comes to healthcare, okay? So I mentioned this idea of actively managing health insurance, and innovative employers are trying to take back control of their plan because they're not leaving it up to the insurance carriers or the providers anymore, which has been our history, right? We're relying on them to manage both the costs and manage care. Well, now employers are saying, you know what, this isn't really working from a cost perspective for us, so we've got to do things differently. But it does require an investment of time and money into these initiatives, and it is definitely not that open enrollment and forget about it, cross my fingers DNA situation. You're paying a lot more attention. It's actually more work, but theoretically, if it's done well, the ROI is going to be much greater. And I would always say, when you're thinking about, like, how do I control costs, your goal should be that you want to be below trend over time. Now, 1 out of every 5 years, you're going to have some bad claims. That's the nature of the beast when it comes to health insurance. But if over that 5-year period, you're half of what trend is, you're winning. So that should be, I would think, a goal that you want to look at. But this approach is definitely not right for everyone. It does require the right culture. So make sure that you're thinking about this. Now, defined contribution. touch on this for a second. If you think about it from a retirement perspective, we used to have a defined benefit arrangement when it came to retirement, right? Pensions. And think about where pensions have gone. Well, they're very rarely still maybe in the public sector, but oftentimes companies have gotten rid of pensions because they recognized that it was an unsustainable path from a financing perspective. Well, retirement went to defined contribution, right? So if I put in 5% of my pay, I might get, a 50% match on that. But it's based on the contribution that I'm providing, and that's what the company will then contribute to my plan. So from a financing perspective, it's a budgetable item. We know what it is. Well, think about it from health insurance. Well, we've got a defined benefit, generally speaking, now, where we're just putting that out, and our health insurance premiums and our contributions are tied to the increases. So we might share 20% of the cost with our employees. Well, we then, as the employer, have to absorb that percentage increase when the renewal comes, as does the employee. So is there a different way of doing it where we can say, we're going to give you a bucket of money to your employees, and then you decide as an employee which plan would be right for you, but you know what your bucket of money is. Now, from a cost containment standpoint, you can do that defined contribution, and you can index your increase to that contribution by something other than health insurance premium increases. You could do it by general inflation. You could do it by the percentage you increase wages for your employees. You could tie it to a number of different things. So essentially what you're doing is you're breaking apart that direct link between premium increases, employee contributions, and employee contributions, and making it a defined contribution, one bucket, okay? Now, for those of you who have been around a while, like me, do you remember this, right? It's really the cafeteria plan, the old cafeteria plan, where it's a bucket of money you set aside and people go in and they choose the appropriate item for them, and then they pay for what that is. We give them a bucket of money to do so. What's different about this defined contribution this time around is that the technology platforms that are available are much better, because really what you need in this situation, because this stuff is so complex, you need good decision-making support. So you need a tool to be able to support that. So that's one technology platform. And two is the insurance carriers are more flexible because, as you probably know, despite the fact that they take on risk, they are about the most risk-averse type of organizations out there. So, but that said, they have become more flexible in being willing to offer more plan designs. So the decision-making support stuff, I just want to mention that for a second. How does that work? Essentially, it works by the platform. There are a number of different platforms, asking an employee about 10 questions about their personal situation. Are they planning a pregnancy in the upcoming year? Do they have prescriptions that they're taking? Those types of questions, about a range of 10. And based on that, there's an algorithm that's run, which then spits out a recommended plan for them. Doesn't mean that the employee has to take that plan, but it helps facilitate the process. So that's innovative employers are starting to use that, because they're recognizing that, particularly with 5 generations in the workforce, they need to have multiple plan designs to meet the needs of their diverse workforce. But at the same time, because this stuff is complex, they need support to be able to do so. So that's a strategy that employers are working on. So I'm just going to check the chat box here. So it seems like nobody has any questions at this point. So that's, I guess, either good or bad. maybe I'm not covering good enough material. Anyway, so here's wellness. So let's talk about wellness for a second. So wellness is, we're a very progressive state when it comes to wellness. We're leading the charge again nationally in terms of our approach. What we've measured over time is what are the challenges that employers are facing when it comes to this wellness stuff. And you can see, if you start on the left-hand side of this graph, the original challenge was how to measure return on investment. So that was the big conversation that everybody was having back in 2008 and 2009. What's interesting is you'll see that conversation has changed dramatically. That is not as big an issue now. The bigger issues are, if we go to the next graph, are lack of staffing or resources when it comes to wellness. Money's always a challenge, we know that, but it's also time now. So there's been a shift in how to measure ROI as the biggest challenge to lack of staffing and time, which are, of course, are both related. I'd also say some new challenges are wellness fatigue and engagement around wellness, because for those of you who have had wellness programs, you probably might have started with like a walking program. And I know a lot of employers did that because it was always this idea of wellness was like the physical aspect of wellness, and that's how we're going to keep employees healthy. And we start a walking program, and it'd be great, and everybody out walking and you rah rah. And then over time, participation would drop off, and then I always say, like, the HR director would look out through the window and see one person walking, and they're like, oh boy, and that's not even our employee. So there is fatigue when it comes to this stuff, and what I'd like to challenge all of you with when it comes to wellness is think about it differently. Don't think about it from just a physical wellness standpoint. There are different ways to go about it. Now, think about it from an overall well-being standpoint, and don't think about it from just an ROI bottom line on the healthcare plan, but more from a productivity and engagement perspective fitting into your culture. We'll talk a little bit about that here. So I like to have you guys think about wellness and cost containment together now, and it's not mutually exclusive. They're not necessarily connected either, but they're not exclusive. It's a more comprehensive approach, and one of the things that's interesting is there are a lot of studies out now showing that the workplace wellness, the traditional way of going about it, it does not lead to necessarily an ROI. So from a health plan perspective, there are good reasons for doing wellness, and we'll talk about it, but it's not necessarily from a save your bottom line on your healthcare dollars, unless you start incorporating some of these cost containment elements that we'll talk to. Now, everybody knows that health plans are way into wellness, so you folks probably all have a lot of tools at your disposal. Sometimes those are hard to navigate, so you need somebody to help you kind of figure out what are the right tools for you. But it's not just about physical health and programming. It's really about overall well-being. So it is still worth it, but it's with a different approach. So here is that different approach. So first of all, really got to look at organizational environment, like the culture first. How does this fit in? There's got to be trust present, so figure if there's not trust, it's not even worth going about it. You've got to measure engagement and interest. It's got to be tailored to your organization, and then understand and explain the why you're doing this. So what is the purpose behind putting in the effort when it comes to this? Because there is a lot of effort. You don't want to create fatigue. You want it to have a measurable ROI, but not necessarily from a bottom line perspective, but perhaps from a top line perspective, or from an engagement perspective, or from a cultural perspective. Understand why you're doing it. And then this idea of we're all in this together. Got to build a strategy to communicate it as well. So as I say at the bottom there, it is more from a top line perspective now. Does this increase productivity? Is it good in attracting and retaining the right people? Make it part of your culture, not just a bottom line healthcare thing. Don't silo it out on the left. Connect the dots, if you will, and then measure. What are your KPIs, your key performance indicators when it comes to this? But it should be based both on productivity and cost containment, and you're going to probably see the productivity measures are going to come first. Think about that in less sick days. Are we getting higher revenue? Whatever those measures might be. So I'm just going to pause for a second here because we've got about 20 minutes left, and that's really, we're going to end up the section on medical. Any questions so far? If you want to shoot a quick chat message, I'll just be silent for a second here and take a swig of my seltzer as I do. Okay. Great, so let's move on. So we talked a lot about private exchanges already. That's when it comes to defined contribution. I just want to mention that it is happening in Vermont, that employers are going down this private exchange, which think about it in terms of a marketplace where people can shop for different plans that are appropriate for them, and using technology to do so. It's happening in Vermont, but there's still uncertainty because how do you make that transition? So again, this is a strategy to consider. We talked a little bit about ACOs earlier, accountable care organizations, so I'm not going to jump into that too deeply right now. Again, that's a separate webinar unto itself. So let's talk about the boring stuff for a second. The boring stuff is the ancillary benefits, and that's a little bit facetious, by the way. But the reason it's a little bit boring is because the dental, vision, and group life and disability marketplace is very, very commoditized. Carriers are just basically taking business from one another, and there's not a lot of new growth. So we're not seeing many cost increases on there, but it's very, very competitive. So one of the things I would posit to all of you is if you haven't done a life and disability RFP in a while or a dental RFP in a while, you might want to test the marketplace, even if it's just to leverage your current provider, because there is a lot of competition out there and people are looking to get business, and it is a little bit easier to transition than the medical side of things. I highlight red there because voluntary benefits, because of this this new move to defined contribution, where you can put a platform together which is meeting the needs of a number of different employees, voluntary benefits is becoming more popular. So if you haven't looked at voluntary benefits in a while and how it fits in within your overall benefit strategy, I would offer that you might want to do that, because people are, again, savvier employers, savvier shoppers. They may want things, and this could put you at a I can't see that word today, uncompetitive disadvantage if you don't do so. And then on the 401k side, we're seeing no significant change there. Employers are restoring their match because back in the recession, they were pulling their match, but we're seeing employers going back to pre-2008 match with their 401k. So again, if you're going to take one thing away from this slide is that you might want to think more about voluntary benefits in terms of how that fits in. Don't make that a silo either, by the way. Incorporate with your overall benefit strategy and make sure that there's value in you offering that you're getting value as well as your employees. And then secondly, you might want to shop some of your other ancillary benefits as well. I want to take just a couple of minutes to talk about HR technology because this is an area that's seen a tremendous amount of growth and a lot of venture capital has been put into this market. And you guys are probably getting hit up by HR technology vendors all the time because there's a lot of competition. What we saw there is that large organizations typically were putting in PeopleSoft and Oracle and those types of systems, and they were only affordable at the larger employer level. Well, there are a lot more technology options available for smaller employers now. And so this is another area what I would suggest that if you haven't looked at your technology, whether it's payroll or HRS or recruiting or benefits administration, this is something that you may want to take a look at because pricing has come way down and there are a lot of good solutions. Now, one of the things I also want to tell you is that you need to have your processes in place first and your priorities related to your processes before you go out and look at other technologies. Because if you just have a technology person or company come in and say, hey, we can do this for you, it may not be a great match. You may find that it's not doing exactly what you want to do. So have your processes in place first before you do that. So a lot of employers, again, are going down this route. It's hard to differentiate the technology now, and so you might see like 4 different demos and say, oh, they all look great. But if you have a specific need that you're trying to get out of it, that's when you can then differentiate and say this one is a better fit for us. But always think about technology as a tool, not a solution. If you don't have the right processes in place first, you won't be able to leverage that tool to get you to a better outcome as well. So again, I'd urge you all to take a look at HR technology. So let's talk a little bit about paid time off for a second. We track this information every other year in our survey, and we are seeing an uptick in the amount of time that employers are offering as paid time off to their employees. We're seeing a couple trends. One is there's a conversation around unlimited vacation time, which sounds a little bit crazy, but organizations are implementing that. And we're also seeing this trend towards less seniority-based time. And that essentially means, like, if you come into an organization and you get 1 week your first year and then 2 weeks your second year, that's now going away to say it doesn't matter how long you've been here, you get X amount of time. And the rationale, I think, behind that, and I've had conversations with employers about this, is that we're having new people come into our workforce. They are not staying nearly as long, but if we can get a really talented employee in the door and give them more time off, that might be a differentiator for us from a attraction standpoint. And even if we only have that talented employee for 3 years, that's okay because that's the nature of the beast now. So again, change is hard, but the progressive employers are starting to look at the way they offer paid time off in a different way. So I'd urge you guys to think about that as well. Is your paid time off competitive compared to the marketplace? Are you still really seniority based, or are you moving more towards a platform where it's more even across the board, regardless of how long you've been here? Because I always say, like, you might have a new employee. If you have a 1 week after 1 year, 2 weeks after 2, and then 3 years after 5, somebody could have 3 jobs within that time frame. So you might be at a competitive disadvantage if you don't do that. So some thoughts for you there. Now, other benefits that we're seeing come into the marketplace is this idea of flex time, where I don't have to work from 8 to 4:30. I can work from 7 to 3, or I can work from 8 till 11, and then again from 3 to 9. And as we start talking about the newer generations coming into the workforce, they're looking for this type of thing. They're used to working in bunch of different ways. If for those of you that are about my age and I'm in my mid-40s, we were very structured in terms of where we were working and what we were doing. Now we can work from anywhere, and that's what the newer generations are used to. So can we accommodate our newer employees when it comes to flex time? And then the other one is working remotely. And I'd also say, we're having a talent shortage here in Vermont. You've probably heard that. We don't have enough young people staying to fill the jobs, and then some of our highly skilled jobs we're not able to fill because the skill set isn't there. So this is this mismatch of things going on. And I saw an interesting article that Brenda Sabin, my colleague here at H&B, shared with me, where a lot of organizations are going out of state and recruiting and just having a working remotely situation. But part of that is having the right technology. How do you incorporate that person into the team? How do you make sure that they're connected? How do you make sure the goals that they're after are being achieved? All those sorts of things. So it's a different conversation, but I'd urge you guys to maybe take a look at this, recognizing that some work needs to be done on site and all that. But if you do have work that doesn't need to be done on site, these are conversations that you should probably be having within your organization. And then lastly, I just want to talk a little bit about compensation. And we're not compensation experts here, but we just want to track a little bit of data when it comes to this, because obviously when you talk about total rewards, there's pay and then there's benefits and then the other things you offer. So what are we seeing for salary increases? Well, we're seeing the average and median was 3%. That's virtually no change from 2016. The highest average increase was 14%. So whatever company that was is doing quite well. And the lowest was 0, which is not unusual. We're still seeing some organizations that are struggling and not able to increase the pay of employees. And then you can see there in the graph what type of salary increases are organizations using. Still, merit is a big one. Cost of living adjustment is the next one. And then you've got some skills-based or equity flat amount for everybody. So the only comment I'd make on the compensation piece of this thing is that make sure that your compensation is allowing for the marketplace. Frank Skadowski, who's a partner of ours, on the compensation front, told a story once about an IT network fellow who was hired out of college. The rate of pay was about $50,000, and did a fantastic job. The pay scale, the highest rate was 6%. The fellow did great. So after 5 years, he was getting 6%, 6%, 6%, which seemingly sounds great. And he was up to about, 65 or 70K after that time frame. But the marketplace then was saying that someone with 5 years experience was about 100K. So that organization lost that employee who they thought they were doing well with because the market was dictating something else. So if you haven't done a compensation review in a while, it may be the time to do it, just to make sure that your pay is competitive in the marketplace. And I know I got a couple chat questions here, so I'm going to finish up with this slide here, and then I'll answer those. So how does this all shake out? Well, medical options, we know that we're going to start looking at number 2 and number 3 there, defined contribution and self-funding active plan management. By the way, for those of you that are above 50 employees, you might want to look at maybe doing a captive arrangement if you haven't already. Those are new self-funding vehicles that do lower volatility and also put you with like-minded employers where you can share some risk and also share best practices when it comes to active plan management. We've got defined contribution, as we mentioned. On the technology options, I think you do want to take a look at this. Standalone benefits enrollment systems being one, because those are much cheaper than they used to be and does allow for this decision-making support, defined contribution, et cetera. And then also payroll, HRS, et cetera. And then ancillary benefits, keep on keeping on, as I mentioned here. Look at defined contribution. Shop if you can, because I think you can maybe save yourself some money. And then voluntary benefits to meet the needs of employees. And that's, again, integrating that with your overall benefit strategies. Wellness options, now think wellness and cost containment, not just wellness. And then the other benefits, look at your PTO, see if it's still competitive. Do you need to change it because you're recruiting different folks or needing to retain folks and it's not working? Consider remote time and consider flex time. So that's essential. I know I covered a lot of information there in about 53 minutes. Hopefully that was helpful for you guys. So let me just see some of the questions here that I've gotten. data on working from home. Oh, the data on working from home, Gina, I'll send that to you so that you have it. And Gina's also asking me why I send the presentation. Yes, I'll send the presentation out to all of you so that you have it and can review it at your leisure. And of course, always happy to answer questions because like anything else, all this stuff you can spend an hour on each one of these slides. But I wanted to give you the big overview of what we're seeing from a trend perspective when it comes to benefits in our state. So again, thanks for taking the time today. Really, really appreciate it. We always enjoyed providing this data. As you probably know, if you've gotten the survey this year, we put it in a different format, which is online, so you get an email to be able to go in and pull the data out. It's all clickable, so you can go to the appropriate sections. And we do customized benchmarking, as you probably know, on this as well. So again, thanks so much for your time today. Reach out to me offline if you'd like any more information on it, and happy to provide it. And in the meantime, I'll get this information out to you. Okay? Thanks, everybody. Take care.